if your job is to answer that phone, you want to crush it. And what are you doing to arm yourself with being able to say, this is what I need to do my job? The other thing I really hate is you call, ring, ring. Hi, can you hold?
Yes.
And I feel like medical, that happens all the
All the
time,
time.
and it's awful. So
Mhm.
if that's you, I guess this is not the scope to go into all of that, but please don't do that. Please don't do that. So we can talk another time about all of that.
Exactly. Don't let that be your default. Even again, if all hell is breaking loose, the phone call is what I call your first impression. Even if it's an existing patient, you're setting the tone for how their appointment's going to go when they come in person. And if it seems like we're so frazzled that we can't even pick up the phone and say hello without placing them on hold, they're starting to build their expectations for how the rest of their visit is going to go, or they're just equally annoyed. Like, you may be annoyed that that phone is ringing and they're immediately like, can you hold? And they're immediately annoyed. So then when you go back to pick up that phone call, you've got an annoyed patient on the other end of the line rather than somebody that was happy to
Get your
speak.
job done, Harbor.
Yeah,
Exactly.
exactly.
Because now you might have to say no 5 times because they want to come in on Sunday at 7 p.m. And you'd have to say no to 7 p.m. and no to 3 p.m. and no to Saturday at 9 a.m. So that can quickly go south.
Now, I know we joked earlier that tone of voice and smile isn't everything in customer service, but it's a really important part of these phone calls. We have to communicate somehow. They can't see us. They can't see our face. They can't see what's going on around them. Only thing they hear is our voice and what we're saying to them. So a lot of a successful phone call really does depend on your tone of voice and how you're reacting to that patient with your voice and with what you say, like we've already talked about. But tone of voice is really important. And this is an age old principle. I remember when I got phone trained many, many, many years ago, the very first rule was you smile. And I know it feels frustrating. You're like in the middle of chaos happening. The last thing I want to do is smile, but people can absolutely hear that in your voice. And I know I look like a weirdo driving down the road and I'm smiling when I'm on the phone because I just realized that that allows a much more upbeat feeling to the phone call. So you need to smile. If nothing else, let that be your number one vocal trick is to smile. But then I think in those empathetic responses, it needs to sound like we're also being empathetic. Saying something like, oh, I'm so sorry that's happening doesn't sound genuine at all. So, oh my goodness, I'm so sorry that's happening. That tone makes it sound like you're actually believable. So we've got to sound like we're happy to talk to the patient. We've got to have inflection. If you're a sweet Sally at the front and you've got a really monotone voice, naturally, your inflection is really narrow, then you're going to have to really pump it up over the phone more so than you'd have to do in person. Because in person, your face helps you, hopefully. Hopefully, your face helps you. But over the phone, all you've got is your voice. So you really need to add some inflection, some enthusiasm, making sure that the pace of your voice isn't too fast or too slow. If you're too slow, even if you've got good inflection, it can sound like the phone call is really dragging along. If you're too fast, it can sound like you've got not enough time to make this phone call. And so a patient can start to interpret, oh, they're too busy for me, or, oh, they're a really fast paced office. And so the patient starts to build these assumptions that you're not going to be attentive to detail or that you don't have time for them. And that is not the tone that we want to set. So you've got to really evaluate. You may need your counterpart at the front to listen to you and go, was I talking too fast in that phone call? If you've got call records, go back and listen to your phone calls. It is such a valuable tip.
Like if you're listening right now and going, I don't know, am I too fast? Am I too slow? Do I have enough inflection? Do I sound happy? Um, Try to listen to your calls. That's the best way to kind of figure out. And it's really eye-opening when you go back and listen and you're going, oh gosh, that was cringeworthy. Or oh gosh, how would I react if somebody spoke to me that way if I had just called to schedule myself? And is that how I would want to be spoken to? So I think we've always advocated for going back and doing call audits. And I think that's one really great way. If you don't even know how you come across and how you sound, go back and listen to yourself.
Yeah. And one other thing that I'll say on phones before we transition out of phones is remember that you're likely in a space where patients in your lobby can hear you and they can see you, which means our face tells all. So if we're annoyed with the patient on the other end of the line and we're like rolling eyes and looking frustrated, our patients out in the lobby are seeing that. And so, just as much as we're trying to put on our best front for the patient over the phone, we are equally benefiting the patients in the lobby. When we hang up that phone, be very careful about what you say about the patient that you just spoke with, not only for HIPAA purposes, but also if we hang up the phone with a frustrating patient and then we look at our counterpart and we're like, ugh, it's Joe again. He's got another toothache. Imagine that, right? Everybody in our lobby has just heard us complaining about Joe. It is not a comfortable feeling at all. So you need to be very careful about what you say.
I mean, it's just like, you know, when you're on stage, when you leave your break room or you enter any area where a patient could be, you are on stage, you are performing, and you've got to watch all of that for the entire duration of when you are on stage.
Yeah, absolutely.